are times where a more aggressive stretching program will be necessary for the treatment of your shoulder. We definitely see a good number of patients who have a diagnosis called frozen shoulder or adhesive capsulitis. That's a condition where there's internal scarring around the joint that limits the mobility. In the treatment of that pathology, it's necessary to stretch aggressively. I wanted to show you some of the techniques that you can perform on your own around the house without any real assistive device or any extra people to help. The first would be aggressive version of a table slide stretch. I recommend you stand next to a low table and basically use your good arm to assist the opposite arm stretching to the overhead motion. We're trying to achieve overhead motion. Run your arm out the table and lean your body down and keep leaning and keep pushing with the opposite arm. Use your body weight to put pressure downward toward the table to keep trying to stretch overhead. The wall crawl stretch might be a secondary effective overhead stretch. Face the wall, put your affected arm on the wall as high as you can get it. Use your opposite arm to help assist and crawl your fingers up the wall. As you get to the top of what you can reach, start to lean your body into the wall. Use the bigger muscles of your core and your body to help achieve further overhead motion. One of the key components of shoulder range of motion is active external rotation. This is frequently lost with injuries, procedures, and with frozen shoulder. The door frame stretch is a very effective way that you can consistently stretch throughout the day to help achieve more rotation. Put your hand on the door frame, arm is parallel to the ground, and your upper arm is resting by your side. If you can, reach your opposite arm around and hold your arm to your side. The stretch occurs when you rotate your body away from the door frame. We're trying to stretch into external rotation. The value of holding the arm is that you don't lose the stretch by having the arm drift off your body. Rotate away. A second stretch, a follow-up to that, is an abduction external rotation stretch. The arm is now positioned with the upper arm parallel to the floor. The entire forearm is against the door frame, and now the rotation occurs at the shoulders. Rotating away. The third door frame stretch occurs like this, two arms out to the side, and you walk forward, catch your arms on the door frame, and you lean your body in to stretch both arms into rotation. Now I'll show you how to focus on restoring internal rotation. Internal rotation is essentially this motion, but it equates to raising the arm up behind the back. It's a frequently lost motion following injury or following surgery. In order to assist the recovery of this motion, I recommend you use your good arm to assist the opposite arm up behind your back. I think it works best if you work right up the midline of your back. Use your good arm to grab your hand as high as you can get it. Bend over. Assist your arm as high as possible. And then stand back up. When you stand back up, try to draw your shoulders tight in the back. The sleeper stretch can be a very effective secondary stretch to help restore internal rotation, that is the motion up behind your back. For the sleeper stretch, you want to lay on the side of the arm that you want to stretch. In this case, it's John's right arm. You start with the body up and down on the side, and the arm at a 90-degree angle to the plane of the body. And then the opposite hand comes across the top, and the stretch occurs like this. You'll typically feel that stretch on the deep back of the shoulder. You put pressure down, hold for 5 seconds, relax off, and then pressure down. The way people cheat this exercise is by straightening out the elbow. You lose the effectiveness of the stretch. The plane of movement has to be right in line with the body. As a secondary follow-up, you can lower the arm to about 45 degrees and now work more toward the body as you're coming down. The most aggressive internal rotation stretch is probably utilizing a countertop or a bench top. Basically, we'll stretch the arm by lowering ourselves down. I'm stretching my right arm